Mr. Harris, President of UCC, Professor John O'Halloran, Vice Presidents, Governors, distinguished guests, colleagues, students, and ladies and gentlemen. My name is Paul Moriarty, and I am delighted to welcome you here to the launch of UCC's Student Mental Health and Wellbeing Strategy. This is a strategy which not only builds on the excellent work of colleagues over the years, but sets out a plan to ensure our students receive the best support possible at the appropriate time. And now it is my pleasure to introduce you to the President of UCC, Professor John O'Halloran.
Thank you very much and welcome to this important launch of the mental health strategy here at University College Cork. And I want to sincerely thank Minister Harris for joining us for this really important launch at UCC. It's a huge honour for me and a real priority for the management team and for me personally that we have this UCC mental health and wellbeing strategy. We are a health promoting university and this forms part of the architecture that we need to support the mental health and wellbeing of all our students and indeed of our staff. During the middle of the COVID crisis, University College Cork, we pivoted our strategic plan into now what we call UCC 2022, which sets out a roadmap for implementation of the strategic plan until the end of 2022. And in that, there are a series of pillars in that plan, of which pillar 3 is called student success. And student success encapsulates a range of strategies, including the mental health strategy, which we're launching here today. We are lucky in University College Cork to have a strong history of successful initiatives in the area of mental health. And we are fully invested and committed to supporting the timely call for an institutional approach to student mental health in reaching its full potential across the organisation. Students must have a whole range of offerings available to meet their needs, from students adjusting to adult learning environment, through to students dealing with stresses of the normal, typical environment. And of course, we had the enormous stress and detachment and isolation of COVID over the last period. Regardless of the stage of life, people become stressful and we want people to be supported. And we want the right for all students living here to be supported across all those dimensions, including severe mental health illness. This strategy, via the matched care model, is designed to create a needs-led system to help students across the right care, at the right place, at the right time. And we saw examples of that during COVID when we were able to deliver a service all more complicated, but at the right time and the right place, somewhat remotely. So on the wellness side, we have had social interventions such as peer support, clubs and societies, physical activities, with UCC Sport, education offering as many range of services as Everyday Matters by Dr. Etna Hunt, online offerings such as the Keep Well web and Instagram channel, which has a wealth of resources and events, the Canvas Success Zone, the Support Tree, which we constructed around our Quercus tree, or the oak tree, and the online CPT program, Silvercloud, via the Graduate Attributes program. So a whole range of support system to support on the wellness side. On the support side, we have mindful classes such as chaplaincy, disability support, the Skills Centre, to name but a few, in addition to our clinical services, student counselling and development, and the student health department. We've taken on new staff into each of these teams, and this type is a top priority and will be about diversification of therapeutic offerings and their objective assessment through strong governance system within teams, robust, that are interdepartmental, and ensuring good communication, that it is patient-focused, student-focused with all our teams, and the creation of effective partnership also beyond the walls of the university to the external services such as the HSE and primary care sector. This work is critical, it is crucial, but it's not easy. I would like to thank all the staff in the university, and particularly in those areas, and their line managers who are working hard to really progress this really important initiative. And we've seen many examples over the last number of months of our frontline staff supporting each other, but also supporting our students, and I sincerely thank you for that. I particularly want to thank all those I've mentioned previously, and in addition to the Students' Union. The Students' Union are critical partners to us in all these initiatives, in particular to ASHA and Quiva, and the previous officers who have worked with us to emerge and develop this project. As always, Paul Moriarty, our Head of and Director of Student Experience, and Paul, thank you for your continued support. Dr. Michael Byrne and his team in student health. Michael, you've always been a fantastic leader in this institution, and we've seen a range of examples here today, but also before that and during COVID, whether it's the antigen testing, whether it's vaccination. So thank you, Michael. Fiona Kennedy and her team in the Student Counselling and Development. And last but not least, Dr. Michelle Hill and the Mental Health Working Group and the Student Advisory Group. Thank you so much for all that you do. Thank you, Minister, for your support and enthusiasm. I'm delighted to launch this really important mental health strategy today. Thank you.
Thank you, President O'Halloran. It is now my privilege to hand over to Minister Simon Harris to formally launch the strategy.
Hello everybody, I'm absolutely delighted to be here virtually today to help launch UCC's Student Mental Health and Wellbeing Strategy. UCC has such a strong history of supporting student mental health and wellbeing and has prioritised implementation of the Student Mental Health Wellbeing Strategy as a core institutional objective. With the increased number of students attending our third level institutions and with a more diverse student body, it is crucial that student mental health and wellbeing are prioritised and championed. Students are one of the highest risk groups of the population when it comes to developing a mental health condition. The COVID pandemic is predicted to exacerbate this issue. This strategy we're launching today aims to provide a needs-led integrated system of supports for student mental health and wellbeing. The strategy recognises this and it aims to offer all students access to the right care at the right place at the right time. And I really commend you for this holistic approach. I was really pleased to see that the strategy aims to both promote wellness in the student body as well as providing effective treatment to those who need it, either through internal supports or by coordination with external supports. And I know you plan to do this by improving mental health literacy in the staff and student population and improving self-care practices such as awareness campaigns, promoting social interventions to combat loneliness and foster connection and belonging, and improving general health and well-being via education on alcohol and drugs, sleep nutrition, sexual health, physical activity. The university has led on responses to issues such as tackling harm related to alcohol use, supporting the development of a framework to respond to the use of illicit drugs, and the development of the Bystander Initiative, which I really commend, to tackle the issue of sexual violence and sexual misconduct on campus. Good mental health and good well-being are vital to everyone's development. I was delighted at the recent launch with my colleague, the Minister for Health, of the Healthy Campus Charter and Framework for Ireland, which aims to provide strategic direction for higher education institutions to embed health and well-being in campus life for all staff and all students. I know that UCC's strategy will be an effective tool to progress the best possible mental health and wellbeing outcomes for students. I want to thank you for all that you're doing. I want you to know that we are a willing partner with you on this journey as we endeavour to return to some form of normality post the COVID pandemic. It is so important. It is so important that we recognise the anxiety, the stress, the worry, the difficulty and challenge that people have faced over the last 18 months. The reality that will have exacerbated the mental health situation of so many of us, and the need to respond to that, respond with resources, but also respond in that targeted, holistic, student-led, staff-led way that you're intending to do in UCC. I really commend you for this, and I look forward to visiting you in person shortly to seeing all your work underway. Gurv Míle Mágaibh.
Thank you, Minister, and thank you for your support in this important area in third level. And now I would like to introduce Dr. Michelle Hill, University Lead for Mental Health and Wellbeing, to talk about the key elements of the strategy.
Hello everybody, and thank you for being here today. My name is Michelle Hill and I'm the psychiatrist here in UCC who led out on the development of this strategy. Thank you, President O'Halloran, for your introduction and Minister Harris for your endorsement of this strategy. The definition of student mental health and wellbeing depends on who you ask, and that is what makes tackling it quite complex, because the response will be based on the person's background or profession. So you end up seeing all kinds of approaches in universities with no agreed model of care or composition of support staff. If you read the literature or ask the students, you'll hear that it is anything from self-care, transitions, exam stress, relationship breakups, low mood and anxiety, to developing and trying to cope with the mental health condition. So the strategy needed to be written to encompass the full range of issues that students face, as it is a time of huge transition, a crucial time for brain development and the age of onset of mental health conditions. There is an increasing recognition internationally that a planned strategic approach is needed at university level, and UCC committed to that quite early. The key components of the strategy, in less than a minute, the vision is simple: to create a system across UCC where students can access the care they need in a timely fashion. We need a structure to support both wellness and rapid access to effective treatment. But universities are large, complex organisations with several departments involved in this space, so it is far from easy to achieve. We need to accurately map out and differentiate the needs that are there and resource accordingly. At this point, we have loosely divided students into 4 main areas of need in a matched care model. The student starts care at the step their needs are at. Step 1 is the domain of universal offerings: self-care, resilience and well-being. And step 4 is severe and enduring mental health conditions, best supported in partnership with the HSC. We have made huge progress in all areas, but need to focus our attention this year on step 3, as this is the area where students can fall through the cracks, or we can end up diverting resources to inefficiently. All steps need to be informed by evidence and matched by a multidisciplinary system with right skills and training. We are in a change process and it can be tough, but I'd like to thank UMT, Paul Moriarty, Fiona Kennedy, Michael Byrne and their teams, in addition to the Mental Health Working Group and the Student Union and Advisory Group, for their support and hard work in this process. Please join myself, my colleagues and the students in the Honan Plaza next Tuesday for the Student Union-led event to mark the launch. Please also join me next Wednesday at 11 for a more detailed virtual presentation hosted on Keep Well, our online space for information on health and well-being here in UCC. Thank you very much.
Now I'd like to introduce our guest speaker, Professor Pat McGarry, known worldwide for the development and scaling up of early intervention and youth mental health services. He was selected as Australian of the Year in 2010 for his work in mental health innovation, advocacy and reform, and has over 1,000 publications in the area.
Well, hello everyone there in Cork, from Melbourne, Australia. My name is Patrick McGarry. I'm a Professor of Youth Mental Health here in Melbourne, and it's a great pleasure to have been asked by Dr. Michelle Hill to contribute to the launch of the strategy for mental health and wellbeing at the University of Cork. Here in Australia, the mental health of tertiary students has been of growing concern. Even prior to the pandemic, we had convinced our federal government here to support a framework, the development of a national framework around the mental health and well-being of tertiary students. And this basically produced a lot of very interesting data showing that particularly the age group 18 to 25, which bear the greatest risk across the whole lifespan for mental ill health, was very strongly represented among students and therefore really struggling in many ways. And it's a hidden health problem actually within universities, and results in a loss of tremendous human potential amongst the students. It's been neglected, there's no doubt about that, and the systems to respond to it are really cloaked in a veil of well-being and that kind of language, which is kind of helpful in a positive mental health sense, but it does cover up the reality of significant mental ill health and even serious mental illness amongst the students. The systems to respond are very outmoded, at least here in Australia and probably in many other countries. They need to be modernised, they need to be better resourced, and they need to be linked to more specialised youth mental health services outside of the universities as well, such as Origin, where I work here in Melbourne. So the principles are quite clear. A staging model is useful. I think Michelle and her team have helped to formulate that there in Cork. That's the way forward, but we have to make sure that we address the needs of the more complex and potentially serious forms of mental illness. So we would love to work more closely with you in Ireland on this problem, and we've worked with Professor Barbara Dooley at the UCD more recently on this matter. So Thank you very much for letting me be part of this. I wish you all the very best with the new strategy, and any way that we can work together, we look forward to doing so. Thank you.